only way to start your day.
It is 6 minutes after 9, coming up to 7 minutes after 9. How are you doing? Thank you for keeping it locked on Spice FM, on KTN, on YouTube, on Facebook, on X, on TikTok, everywhere that you follow this conversation on. City, you know, there's somebody who's watching this now.
Yes.
And it's not now, like 7 minutes after 9. They're watching this weeks after the show aired. And that's what we love about, our audience. There are people who will be watching this conversation later today, hours from now. There are those who will be watching days from today, weeks from today, and months from today. And the conversation will be relevant to them at that point. And we want to appreciate you who is watching this conversation later. Okay? Mm-hmm. This is a dedication to you. Now, let's talk about the now. The NCBA looked at how people are just, juggling things in life, one thing into the other. It's you want to go into the bank, then you go into the bank, you withdraw money in cash, you walk over into the M-Pesa place, you deposit the money into M-Pesa, and then you send it to your workers, and it's too much. No. Or you want to remove money from account A to account B, so that account B then can help you move money from they said, you know what, in this era of digital transformation, how about we create a platform that actually serves all these things into one? Mm-hmm. They did that. And they said, what does it do? It gives you all these services one after the other. Your life is basically a loop. Yep. You wake up in the morning, you've got bills to pay, you've got transactions to make, you've got savings to do, you've got decisions to make, you want time to save. All those things are in a loop, and they called it loop.
Exactly. Because running around is so 2003, You can actually get all things done.
It's so kibaki.
It's so kibaki.
I told you about my Gen Z employee who, one time we're having a conversation, you're brainstorming about a pitch you're taking to a client, and you put up some ideas, and she was like, psh, that's so kibaki.
And you were like,
hey, surely.
As for them, that is such a long time. It's so old. It's so 2003.
Yeah, it's so 2003. Why? When you can do it all from the comfort of your phone, wherever you are. Even if you run a business, you can advertise, you can pay, you can buy, you can borrow, you can set up standing orders, pay your bills all in one. Just like that. It's a lifestyle.
Yes, it is.
It is.
It is. Do you want 2,500 in your account? All you need to do is download the Loop app, register into it. Or if you've downloaded, make a transaction right now, okay? And send us a screenshot on our social media platforms. That's Spice FM KE on X or Facebook. Our AI is going to select one person, and we're going to deposit 2,500 into
your Loop account.
The Loop account, okay? Yeah. So our next conversation is going to be about the government. The big thing that the government is right now doing, among others, is realizing the universal health coverage. It's one of the 5 big agendas of the Kenya Kwanza administration. We keep talking about them. Number 1, all of them are to improve the economy, create jobs. 1 is agriculture. Support the agriculture from all the way from production into value addition, into development of markets, into making sure that then more people are employed in there. Housing, improve the level of quality houses that we have in the country. It'll employ people, it'll bring down the cost of houses, we'll have better people living in better houses. 3, MSMEs. Make sure that we support MSMEs in whatever angle. Hustler Fund and others. Access to credit, access to markets, access to opportunities, MSME development. For all those to happen, you need to have a healthy population. Now, healthy population is where UHC comes in. Support universal access to healthcare. What is that? Access to affordable and quality health services across the country for everybody in the country. And the digital superhighway, which then comes to support all these things by making sure that you have access to the digital superhighway, which gives you access to job opportunities where you're working from here, and Kenya becomes a hub for international jobs, business process outsourcing, that you can also do all these things. You can then have access to Wi-Fi from wherever you are. All those things. Those are the things. Today, let's talk about this UHC because that is where we are. Senior advisor to the president in the Economic Council of the President, Moses Kuria, is our guest. Good morning, Moses.
Good morning.
How are you?
People. Very good.
Yeah?
Yeah.
Okay.
Good to see you again.
Good to see you as well.
Yeah.
You're keeping well?
Keeping well.
Sasa hii role ya senior advisor.
Uh-huh.
Why senior?
Well, because they are junior. Only for that reason. That's simple.
I mean,
You know, if they are junior, they must be senior, isn't it?
What's wrong with what's wrong with you? Don't you understand English? What kind of question is that you're asking?
there must be somebody
exactly.
above them.
Yeah.
What are you talking about?
Yeah.
Sour.
Yeah.
We live in that city. Please give the senior advisor.
Okay,
The name is Proverb.
let me give him a senior proverb.
Okay.
Our proverbs for the whole of this week are from the Gambia, the Republic of the Gambia. Okay. If you stir up water in the pond, you will bring up the pond.
If you stir up the water in the pond, you'll bring up the pond. What's the interpretation of this one?
I think, you know, there is no pond and the water. It's in the water, the pond, isn't it? Yeah. So the water is the pond. So if the water comes up, the pond comes up, isn't it? Yeah.
So if you stir up the pond, are they telling us it doesn't matter?
No, what they're telling you is that sometimes it's better to leave things the way they are. You avoid trouble. Yeah.
Leave
You
them.
might think that you are stirring up the water, and then, you know, you bring up the pond itself. Yeah. You get more than you bargained for. So be careful.
And this requires wisdom.
This requires wisdom.
Indeed.
And this world requires a lot of wisdom. A lot of wisdom.
On a daily basis.
Every time. Every time.
Moses, last year, this month, you were in the cabinet.
Yeah.
And a couple of months prior to this, you had sat in a cabinet, I presume, that had looked at several bills that were geared towards universal health coverage.
Right.
There were 4 bills that were taken to Parliament, they were passed by Parliament, and were assented to this month. And the President in Kericho said, now 4 laws are in place. We are launching universal health coverage, part of our promise
Yes.
as a Kenya Kwanza administration.
Yes.
Since then, there have been conversations. We actually have had conversations here with people from the Ministry of Health, from advisors, the presidential advisors on matters of health, from NHIF. Then the SHA was established. We had a conversation with the first chairman of the SHA, to a board member of the SHA, who then became the chairman of SHA. He has also sat here as chairman. We have had conversation with the cabinet secretary, principal secretaries, and now we are in SHA. And these are the headlines we are seeing.
Nightmare. Let me say this. Let me put this in context. For the last 3 decades, I've been involved in so many project implementations across many countries. Many countries. You know, I've worked locally and internationally. And this is a huge project by any means. I'm happy that even we are talking about a nightmare, and we have got a project right now. Let me say this because when I was appointed by the president to be, an advisor, I picked on 3 priorities. One of them, I'll talk to you about the others, one of them being health, because I do believe that this is a very important project. If you look at the other projects that we are implementing, last year we implemented our agriculture project, the fertilizer project, registered 6.3 million farmers onto a digital system, delivered, a fertilizer for the first time using e-vouchers. I think you're just talking about Loop. Yeah. So now imagine if the same thing you're saying about Loop was being implemented about government, it could be defined as a nightmare. Yeah. So it's not unusual, especially for government, because government don't exist to be loved by their definition. You look at our education system, we've got a system that goes by the name of NEMIS, where all our kids are. Again, that's around 14 million. If you look at even the ones in the universities, you look at the money we send to our old people for the social protection money, 1.7 million people are in that system. Let's compare that now with what we are doing now with the SHIF. All 54 million people are going to be in one system. It is really the universal. When you talk about universal, you're talking about 54 million people joined in one system. It is bigger than the National Registration Bureau system, the one for the IDs. Because again, if you're not 18, you're not in that system. So never before in the history of this country have we had a system that encompasses all the 54 million customers, all of us, me, you, my mother, my child, all of us together. So it is natural that in a system, even a small one, will have some problems,
Hiccups.
some hiccups. So let alone this one, where it's supposed to be all of us, bigger than agriculture, bigger than school, bigger than ID system.
Yeah.
If people talk about Maisha number, this is a real Maisha number. And for me, when I look at this system, it is not about health. Health is just a byproduct. It is the first time that we are going, it is actually what I'm calling a system for law and order, whereby, you know, I remember when I was working abroad, when I got my son in Saudi Arabia, and he was registered in a system, and then I bought a car, and the car was registered in the same system, and then I bought a dog, and the dog was registered in the same system.
Did you actually buy a dog in the system?
Yes,
Okay.
the system. You have to.
Just checking.
Yes, yeah, because you have to. You have to. So
the dog, car,
Dog,
son,
child,
same
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 system.
loan, same system. Yeah, that's I like really your opening remark, because that's it now. Once we get this right, this is the health is only a byproduct. We can have a system now that is predictable.
It's fantastic.
You know that you can be able to say, who is Moses? Moses is son of Teresa, my mother, who can be tied to me in the system, and is the husband of Joyce, and is the father of Brian. You know, and Brian is in this school, and grandmother, despite Moses being a senior advisor, paid well, grandmother is in the social protection system. How?
Well, actually, I actually agree with you.
Yeah,
I think that it is a fantastic system.
Yeah, absolutely.
My
So
question,
I really want us to be driven by the opportunity, by the good thing, not by the hiccup because we are about to have these things. But once we get it right, it is unprecedented.
My question is this, because you're right. You are right. And I think that there are several countries that have a system like this, just like you've said. My question is, though, that why wasn't it practiced for some time to see how it would work before you stop a system that was working and serving people and start on another one which is presenting with more than hiccups, the issues that Kenyans are going through today? Would it not have been possible to pilot this thing? Because like you said, it's a grand thing. It's not a small thing that you're talking about here. Why was there not the option of saying, let's have this thing running concurrently with NHIF for some months?
But
let's see how we can migrate people. Let's see how it would actually work before we now plunge people into the more than hiccups that we are seeing today.
You're actually drawing me back to my forte of implementations. This is my cup of coffee.
Yeah.
I am a fan of, and I'm a firm believer of coexistence of parallel systems during implementation, so that you reduce the risk of failure of projects. But I'll tell you two things. One, we are already in a parallel mode. NHIF is still in place up to, for example, as an institution, up to the 22nd of November. So we are there's really a lot of coexistence happening, even as we speak right now.
Not for the provision of healthcare.
No, it is. Nobody, we have said clearly, nobody is supposed to be turned away for whatever reason. But whether they have paid, they are not paid, as long as you are registered, and as long as the facility is registered,
yes,
nobody is being turned away. Last night, I got a complaint from one of our advisors, Dr. Duranira, coming from Meru. And there was a memo from somebody, I think a CAC in Meru, saying now you pay for cash. You pay cash for some
service.
For some services. And I sent it to Governor Kawira Mwangaza. This morning I've had a discussion with Kawira when I was coming to this studio. And she said she was not aware. Yeah? So there's going to be a lot of those things of fine-tuning. What I would want, that's why even we are going to work with everybody, with the stakeholders on the ground, with the media, with everybody. So the only way to solve some problems is through what I call iteration. It fails here, you fix it there, you fix it there until you get it right. So simple answer is already we are in some form of coexistence. Two, if you have been contributing to NHIF, your NHIF, there's portability of your contribution. So you are covered until the last point of your contribution to NHIF.
Okay.
So that's really some portability. That's really coexistence. You are carrying that with you.
Okay.
Yeah? 3, and this is more fundamental. We had experience in the fertilizer program, and I was right in the middle of that implementation. In the previous government, in the last year of the previous government, the people who received subsidized fertilizer were only 20,000 farmers. The ones who are claimed were in the millions.
Hey.
Sometimes a system is so rotten that, coexistence, is actually like saying, why can't I live with the cancerous wound and a septic wound? And
as I heal.
Do you know the mess that has been there in NHIF, my friend? A small hospital, has done more dialysis than Kenyatta National Hospital for a whole year, and claiming and being paid for that. A hospital has done more amputations and being paid for that more than Kenyatta National Hospital. Men have delivered children, and hospitals have claimed and have been given money for that. Sometimes, unasema kama ni mbaya, because, the road was just too much. And some people are saying, why NHIF? Why not? I heard even on radio yesterday, which is about to happen, I heard some people saying, waturuhusu tubaki kwa NHIF. Then I said two things. I remembered it was the same thing when the children of Israel were leaving Egypt. Along the way they were saying, it's better Pharaoh,
We had punished.
You are even, easier. If they know what they are saying, we would go back to. And you know what? Even when the car was invented, people said they wanted faster horses. Why are you bothering us with the car? So there are cases of people being comfortable with the old and what they are used to. But the reality is, once they get used to the new things, to the certainty, and I can take a whole day talking about the differences between the old and the new. But the best way for us to convince the people is experiential.
Okay,
Exactly.
Yeah?
please, let's look at the issue on the ground.
Yes.
Because we can talk about coexisting programs and parallel programs, which I'm a huge advocate for, until you know that one is foolproof. Now, because we did not know or we did not practice one in a state where it was foolproof, we have situations whereby we have women, men, who are in need of critical care, Moses, who are not getting it today. Day 1, day 2, we're going into day 3. Where because one system has not carried over to another, they're actually not receiving the care that they need.
It's not a system issue.
So
it's
what is
a
the
people
issue? What's the
It's
issue?
a people issue.
What's the issue?
It's a people issue. It's a non-compliance issue.
By the providers?
By the providers
They're
on the
not
ground.
complying?
They're not complying.
How?
Yeah, because we have said very clearly, nobody who is a member of SHA from a licensed, contracted, as we are calling it, facility is supposed to be turned away. And what we are doing is that we have got a hotline, we have got a call center. We are going to actually, I'm just heading from here to our contact center and ensure that today we publish the hotlines, the call center numbers for anybody who is being turned away for any reason. Because when those people are turned away and they contact us, and we're going to have, to publish all the touch points, whether by SMS, whether by WhatsApp, whether by anything, of all the people, these cases of people are being turned away, you're actually doing our job. Because you'll be helping us to be able to identify the non-compliance point. Maybe sometimes it's I'll give you an example. A senior member in government, he's a director somewhere in the ministry. He called me yesterday and told me, I think I want to help you because I think there's a problem of the system. There's something we are calling means testing, where you're supposed to be assessed on your means, how much you pay. He's on a payroll. Yeah, so 2.75%, the means testing is working. Then he told me, how come my wife is the assessment and she's not working, is coming too close to my, because him was getting around 5,000 shillings assessment, and the wife was getting 3,750 assessment. How come this me who is employed is getting very close to...
and the information she has inputted is not showing that she has any income.
That's really the problem. Then I said, look, so I'm just, why am I talking about this?
Yes.
To show the need of people reporting so that we use the reported cases, realizing that any system is about to have
To
issues.
iterate.
And we use it now to make the system work even better.
That's
Then,
the case for piloting,
so
isn't it?
No. It's a case of, it is different because no system can solve that. You know why? Then it occurred to me that even me, I don't think I was using my brain properly. Because I didn't ask myself, how can this guy be assessed and the wife is assessed? And that's a household.
It should be a household.
It should be a household. So it turns out that the guy never linked, before he went for means testing, you are supposed to link your dependents to you so that you become a household. You become a unit.
Right.
Yeah? So
Information.
what God put together,
No.
the system put asunder in this case. Because, you're supposed, so you realize
there are
that...
several things that are coming out here. Key among them,
One key among them is communication.
is information.
Information, yes.
Yes.
I agree on that. On that one, mea culpa, mea culpa,
So
mea
let's
culpa.
go back into
And
this.
we will work on communication backwards, And because, we have to actually segregate issues of information with issues of the system and the technology working. Now, issues of information is about two people. It's about the person who is supposed to be giving information
And the provider.
and the someone who is
receiver.
supposed to receive the information. Be them provider, be them the member who is covered, and we are work in progress. And you know what, Eric, from where I sit, I am over the moon about how successful this implementation has been, given the magnitude that the issues now. Every day I'm tracking the number of issues. And if you go to my social media, I am really tracking the numbers as they come up and publishing every day. I am, from today, I will start actually saying not just the good things, but also the bad things. Yeah, so because that's how you improve systems. That's how you improve life. You improve life by iteration. I am surprised by that until now, we're talking about 1, 2, 3, 4, 5 numerous issues that we have to deal with. Which, in my opinion, in the next 2-3 weeks, if we just keep on, tightening the screws on those issues, then we are going to have a very good system.
Moses, those service providers who don't have information, what they don't have information on is this migration and how it's working, how they document that Moses has come to my facility and that I have given Moses this service and therefore I shall claim, right? Because, like you've said, the history has been that there have been issues of fraud. And the main suspicion here will be, if you just come and say, on Monday, there was Eric, there was Ndu, there was Moses, there was City who came to my facility, and, the system was down. They were telling me that they have transferred, and I looked at them, and I looked at the government instruction, or provide a service, so here they are. The next thing, the ministry official will be like, how do I know that these 4 people came?
You see, now
do they have information on what they are supposed to be doing? Yes, they are supposed to accept the people. But how do they document that these people have come if their system integration has not worked on their end?
Now, let's talk about that word, system integration. Right now, we are not requiring facilities to do system integration. I think it's very important to notice that. We have got 2 kinds of facilities. Facilities which had their own systems. Mostly level 5 hospitals, big hospitals. They had private hospitals, faith-based hospitals. Those ones had the luxury of having their own, what we call hospital information management system. That is where the issue of integration would come in. There's the other category of hospitals which didn't have any system at all. Now, where we sit today, whether it is the big hospitals, the lucky ones who have got their own systems, or the ones which didn't have a system, in this first phase, we are not even looking at their own systems. The what we are calling the provider portal, which can be directly accessed through a link, through a URL. You go in there, That's where the patients are being registered. That is where services are being offered. It is not really an end-to-end. Again, coming back to my sister's concern about the coexistence. We are coexisting because we are using their old systems as they are, but we're saying, please go directly to the provider portal and log in all the patient information and all the treatment information. And it is there that also they are going to load their claim. This time only, not by a piece of paper, but electronically, through what we are calling the e-claim system. Now, I know over the last 2 days, the e-claim was mara up, mara down, and that's all the problem. I can promise you, Eric, you are lucky, me and you are lucky that we are sleeping maybe 2, 3, 4 hours a day. There are some folks there who've not slept for a whole week. Not a single minute of sleeping. I know even up to last night, the team that is working on e-claim, they have burned the midnight oil to ensure that today at least, on the e-claim, we're able to settle the claims and we're able to discharge patients today. If you come next week, you find this whole system for the claiming working seamlessly. Very few people will remember the kind of problems that we have come through with. So all I'm asking, please, is because the good things that will come from this system far much outweigh the labor pains that we are going through right now. Let Kenyans invest even their emotion and their support somehow to bear through the kind of hardships that we are going through, because just like labor pains, the product, the baby when it is born, is going to be pleasant, and it's going to spread joy to everyone. So the small inconvenience of the labor pains is something that we should bear with. And by the way, this is not without precedence. I remember during fertilizer, there was hue and cry. When now the price of hunger came down because our fertilizer and the pains that we went through that time, nobody remembers the pains that were there that time. Just like a mother will not remember the labor pains. Yeah, they will just see the joy of the baby soon, very, very soon. And I think that's what you need to be talking about. So what are these wonderful good things?
What are the joys?
After, what are the goodies after we come through from the labor pains of what we are going through? And let me say, Eric.
Let's take a break.
Yeah.
Then we can say 26 minutes to 10. Moses Kuria is from the President's Council of Economic Advisors. He is a senior advisor. He's here today. We are talking about overseeing the successful rollout of universal health coverage. What are the things that we are looking at? What is it? What's the picture ahead? And what's the picture at present? Back shortly. Keep it here.
This is the Situation Room, the only way to start your day.
Do you want to live out your life? Welcome to iVibe Africa, your best